Okay, in our first lecture, we were looking a little bit at the history of utilitarian thought and Bentham and Mill's view that you could kind of do this uh, hedonistic moral calculus, kind of measure the hedons and come up with the right response. But I think in today's standards, we recognize that that's pretty optimistic, that morality is not as empirical as that, and that we need to find better ways to evaluate the pluses and minuses that might come with any particular action or decision. So in this section of the chapter, we're going to look at two ways to balance out um, the positives and negatives. One comes from natural law theory called the principle of double effect, and the second is really your author's um, position of a better model, and that's the principle of proportionality. So let's first take a look at the principle of double effect. Again, this comes from natural law theory, which, as we saw, has both secular and religious dimensions, but basically claims that actions or decisions that are in line with the natural order um, of, of, of nature, of the universe, of human beings, is to be abided by or accorded with. So let's go through these four principles of double effect, and then we'll see how it gets applied to a particular medical procedure in Roman Catholic thought. So the action itself must be good or morally indifferent in itself. In this way, the principle of double effect would not justify a particular action or means that they would find inherently immoral. The agent must intend only the good effect and not the evil effect. So again, while there might be negative results, that's not what's intended. The evil effect cannot be a means to the good effect. We're going to look at that one in a little bit. There must be proportionality between the good and evil effects. Okay, so let's look at an example here. Many will often claim that in Roman Catholic thought and in natural law theory, abortions are morally forbidden. That is the natural development of the fetus into life, and that this contains the dignity of a human being. But there are cases using the principle of double effect that abortions are acceptable. So let's take the example of a woman with a severe form of cervical cancer where a hysterectomy, a full hysterectomy, needs to be performed in order for a woman to be saved. And let's, in addition, say that this woman is pregnant and carrying a fetus. Is a full hysterectomy, which would result in an abortion, morally acceptable? Okay, if we go through the principle of double effect, the procedure, the hysterectomy, is not in and of itself morally problematic. The intent is to save the woman's life. We could also note that, if the cancer were to continue, the fetus would not survive. It is not a result of the loss of the fetus that the woman is saved. In other words, it's not the effect of the abortion as a means towards the hysterectomy. And the two results are weighed, and saving the woman's life is certainly the intent. That's what's kind of being valued. So in this case, yes, the, this full hysterectomy, which results in the abortion of the fetus, would be morally acceptable with the principle of double effect. Your authors raised some concerns about this, and if we were to look at kind of modern technology today, we can see that with advances in some techniques, the principle of double effect does not quite hold up. So let's shift it to an issue where a woman is pregnant with an ectopic pregnancy. This is where the egg is fertilized, but instead of it being implanted into the walls of the uterus, it implants either in the fallopian tube or in an area that's not going to develop. We now have procedures where we can use laser surgery to get right at that source of the atopic pregnancy. Or your book gives examples of more specific um, partial hysterectomies that might be needed. Um, this becomes morally problematic in the principle of double effect because um, this condition that the action must be good or morally indifferent, if the very means of the laser procedure is, aborting the fertilized egg, then um, we have a very kind of direct form of procedure that results in the abortion. The evil effect cannot be a means to the good effect. Again, with something as specific, um, this might raise concerns. So your authors instead argue that the principle of proportionality, which is going to contain some of the ideas of the principle of double effect, is a better way to kind of weigh out intended goods and unintended evils. So let's take a look at that. The principle of proportionality basically says that provided that an action does not go directly against the dignity of the individual person, so there's that appeal to, informed consent and the intrinsic good of the dignity of the patient, then there must be a proportionate good to justify permitting or risking an evil effect. So, provided it doesn't go against the dignity of the person again, proportionality contained can be judged by the following. Are there alternative ways of attaining the intended good with no evil or less evil effects? Okay, so you're looking at a variety of different procedures that try to get at the intended result. The level of good intended and the level of evil or risk is permitted. So there's a section in your book which talks about, unjustified or unneeded surgeries. Proportionality needs to take a good look at, what's the intended outcome and is it worth going through the dangers and risks of surgery. The certitude or probability of the good or evil intended is permitted. Okay, so again, proportionally weighing that out. The causal influence of the agent needs to be explored as well. So I think this is a way that tries to avoid maybe some of the particulars of methodology that we saw in the principle of double effect and is looking more at the risks that might be involved in whether it's a surgery or a drug routine and trying to see if there are other ways to attain the good that preserves the health and well-being of the patient. We recognize that some things are merely useful for the life of the person, while others are necessary for human life and dignity. So that gets again at some of the goods that we were trying to determine in our first lecture. And that which threatens basic human rights and dignities is considered serious. So while certainly the individual patient might have certain values and goods that need to be recognized, that inherent dignity and right of the patient must always be preserved. It also says that we can note that there are almost always risks, and so we have to weigh whether these are serious risks or are they so small that it's not worth going through a deeper analysis of proportionality. Um, and while this principle of proportionality can be complicated, um, and it's not always precise, it's a better way of trying to inform and balance out those levels of good and evil. So, the wedge analogy was one example that was brought up where if we if we think about this balancing act, right, of goods and evils, then if we were to kind of put a wedge into, the analogy of kind of a log, you'd split that log apart and destroy it. And its underlying idea is that in defending a given position, even a small concession will destroy that position. Well, we might look at a number of different factors that come into that analogy. I think your authors want to argue against the wedge analogy. most effects are the result of really many causes. So it's not always clear that one thing will kind of tip the scales. In many cases, there's no causal influence and no possibility for a given person to change a situation. So, while we do want to always be aware of avoiding evil, we have to be aware that avoiding evil and evil consequences are needed unless you have a proportionate reason for taking the risk and permitting them. So just again, trying to say that one factor doesn't necessarily throw this off. All right, we're going to get a little bit into decision making for both patient and healthcare provider as well as surrogates as we look at the balancing act of proportionality.